Stephanie.
Nice to meet you.
I'm a nurse practitioner student. I'm just going to be doing your assessment today, focusing on your lymph nodes, your lungs, and your thorax. Okay, so let me just wash my hands over here for a minute. Okay, good. We'll get started with your lymph nodes, okay?
Okay.
So I'm just going to palpate them in circular motions. Let me know if you feel any tenderness, okay? So I'm going to start with your preauricular, postauricular, okay, occipital, tonsillar, supramandibular, okay, submental, posterior cervical, anterior cervical, deep cervical, okay? Any pain or tenderness there? Good. And now you shrug your shoulders up, supraclavicular, infraclavicular, okay? And then let me see your arm here. Epitrochular, do this side too. Same epitrochular, okay? Any pain or tenderness?
Nope.
All right, good. So lymph nodes are about 1 cm throughout, movable, symmetric, soft, non-tender, so that's a good thing, totally normal, okay? So now I'm going to move to check your back,
Okay.
okay? And the first part of the assessment is inspection, so I'm just going to take a look at your back. I'll have you lift up your shirt, okay? Very good, that's fine.
Okay.
All right, so the spine is completely straight all the way down. Just looking at it, I don't see any lesions or sores. Skin color is equal throughout. No abnormal moisture or dryness. Scapula is symmetrical, shoulders are symmetrical, trapezius muscles are symmetrical. They look, a good strength for your stated age, which is 24.
Yep.
Okay, good. So everything looks good there. I'm just watching your breaths, as you breathe, and just monitoring your respiration rate. I do this during inspection so that you're not aware of it and your breath sounds don't change, or they're not labored because you're thinking too much about it. So as I'm watching you, your respiration rate is about 16, which is totally normal. It's even, unlabored. I barely even hear it, which is normal. No shortness of breath or wheezing. So everything looks good there. So that's the inspection part. Now moving on to palpation. What I'm going to do is palpate down your spine and just let me know if you have any pain at all, and then I'm going to check your scapula and tell me if there's any pain there too. Okay? Any pain?
Nope.
Okay, any pain?
Nope.
Okay, good. All right, any pain here?
Nope.
Good. So next I'm going to check for your chest wall expansion. So I'm going to bring my thumbs down here to T9 and T10 and just press my thumbs together to get a skin fold. And what I want you to do is just take a deep breath in. Okay, perfect. So you can release. So basically I'm seeing exactly what I want to see. Thumbs are expanding symmetrically, so the chest expansion is equal bilaterally and strong. So next what I'm going to do is palpate for tactile phremitis. And what I'm going to have you do is say 99 as I move my hand down your back, okay?
99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, so everything sounds good. The phremitis gets softer as I go down your back, but it sounds, it's pretty much the vibration is equal on both sides.
Okay.
All right, so now I'm going to move to percussion, and I'm going to start percussing the costovertebral angle, which is down by the 12th rib. And I want you to tell me once I percuss if there's any pain or if you just feel a thud.
Thud.
Okay, so that's totally normal. And now I'm going to percuss down your back and in the intercostal spaces. And I just want to make sure that I hear a nice normal sound of resonance, which is just because there's a lot of air in your lungs. And I'm not, I'll have a dull feeling over your scapular or your ribs. So I'm going to start with that. Okay, so so the sound is resonance, and which is completely normal. Okay, so next I'm going to check for diaphragmatic excursion. So that's telling me the size that your diaphragm moves during full inspiration and full expiration.
Okay.
The normal size is about 3 to 5 centimeters. So what I'm going to do, and I don't want you to do it now, but I'm going to have you take a deep breath in, and I'm going to percuss down your back until the sound goes from resonant to a dull sound. And then I'm going to mark this spot and then do it again on the right side of your body. So I'm going to have you take a deep breath in now and hold it. Okay, so about there. Exhale. And then I'm going to do it on the other side. Okay, deep inhale in. Okay, so about here. All right, so I have my marked spots, and so now what I'm going to have you do is, not at the moment, but inhale nice and deep and exhale and hold your exhale, and I'm going to go up from that marked area until the sound goes from a dull sound to a resonant sound, okay? So I have my marked area, so inhale and exhale nice and good, and hold the exhale. Okay, so right about here, and you can relax. And then I'm going to do the other side, inhale nice and deep. Now exhale and hold it. Okay, good. So that's about 5 centimeters, which is totally normal.
Good.
Okay, so now I'm going to move on to auscultation. I'm going to listen to your breath sounds and just make sure that they're nice and clear. I'm listening for any adventitious sounds which would be considered abnormal, like any crackles or rails or rhonchi. Okay, so I'm going to go through your lung fields for that. Okay. Deep breath. Good. And one more. Okay. Does it sound okay? So your lungs are nice and clear. I don't hear any crackles or rails or any other adventitious lung sounds. So pretty much the bronchovesicular sounds are heard closer to the spine, and the vesicular sounds are heard more in the peripheral lung fields, which is totally normal. Okay? Okay, so now I'm going to move to the front of your chest.
Okay.
And start with inspection. Sternum is midline, thorax is an elliptical shape, and ribs are going down a 45-degree angle, which is totally normal. Same with your back. I didn't mention that before, but your thorax is also the midline elliptical shape, and the ribs are going down at a 45-degree angle.
Okay.
I don't see any obvious sores or areas of concern on your skin, any breakdown. Skin is even throughout and no extra moisture. So I'll start with a palpation. So what I'm going to do is just palpate down your chest and just let me know if you feel any tenderness, okay?
Okay.
Any tenderness? Okay, so I'm also going to check for chest expansion. So I'm going to do the same thing, just having my fingers here and pressing the skin together. I want you to take a deep breath in and exhale. Oh, good. So same expansion as bilateral and symmetrical. Okay. All right, and then I'm going to also check for tactile firmitis again on the front side. And I'm just going to go through and I'll have you say 99 again.
99, 99, 99, 99,
Okay, and then above, I'll have you lift up your breast tissue
99,
and then the other side.
99.
Okay, so it's equal throughout as well. And then I also want to listen to your lungs.
Okay.
Okay. Starting here. Okay, I'll have you lift
lift up your breast tissue too.
On the other side. Okay, so same as before, nice and clear throughout. I don't hear any adventitious breath sounds. I do want to just listen to your back again and do another test. And what I'm going to be testing right now is for bronchophony. And what I'm going to have you do is say 99 as I listen down your chest, okay? So start now.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, good. So I'm not really sure what you're saying. I do hear a muffled sound. It's soft, which is absolutely normal. So now moving on to agophony, I'm going to have you say E as I move my stethoscope down your back, okay? E, 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 E. Okay, great. And I hear an E, which is normal. And now the last test is pectriloquy, and what I'm going to have you do is whisper 1, 2, 3 as I move my stethoscope, okay? So same type of thing. Okay, and I pretty much don't hear anything. It's inaudible, which is normal.
Okay.
Okay, all right, well, great job, and I hope you have a great day. Nice to meet you.
Nice to
Okay?
meet you too.